I want to say hello, good morning, and welcome to Emerald Ash Borer University. My name is Robin Usborne, and I'm from Michigan State University. Along with my colleagues Anne Marie Nagel from Purdue University and Amy Stone from Ohio State, we hope you'll find this webinar informative. Today, we will continue our municipal management series with Dr. Geoffrey Donovan. He's a research forester for the USDA Forest Service at the Pacific Northwest Research Station. His presentation today quantifies the importance of urban trees in a community, including a discussion of their impact on property values and tax revenues. He will also discuss the link between decreased urban canopy and the increase of human mortality in communities where EAB has killed ash trees. I wanted to let you know, if you have questions during the webinar, please feel free to write them in the chat pod. We will be responding to the questions after Geoffrey has finished his presentation so as to keep the flow of the presentation going. And if you will stay tuned to the end, we will be trying to get some feedback from you, and we'll be providing a link to the survey slide that we'd like you to participate in. And just so you all know, for those of you that need CEUs, your survey information is necessary for us to process those CEUs. The first 10 people to participate in the survey will receive an EAB goodie bag. And even if you've already gotten an EAB goodie bag, we'd appreciate it if you would also give us your feedback. This webinar is being recorded, and it will be available for viewing this week at emeraldashborer.info. You will also find the recordings for all previous EAB University webinars there. We always want to know how we can make these better, so please feel free to give us your feedback. Thank you for attending today, and with that, welcome Jeff, and I will bring up your presentation and we can begin.
Thanks, Robin. Well, my talk today, let's see, hopefully is my slide going to appear? Wait 1 second. It's going to be split into two parts, although there's going to be to some degree a crossover between the two parts. In the first, I'm going to talk about two studies looking at trees as investments, and in the second half I'm going to look at two studies viewing trees as medicine. This slide, by the way, is 72nd Avenue in Portland, near where I live. The grassy median down the middle there is an old tram track, and they just put these double row of trees in it, which are one of my favourite urban scenes in Portland. So only one of the four studies I'm going to talk about is directly about EAB. However, the other studies quantify benefits of urban trees, so they're relevant because these are the benefits that are going to be lost if EAB kills trees. So let's talk about trees as investment to begin with, and to provide a frame of reference for trees as investments. I don't know if any of you know the best performing stock of the S&P 500 last year. Well, Sprint Nextel stock went up 138% in 2012. I think that was mostly by overcharging me, but nonetheless, impressive performance. So imagine today was January 1st, 2012, and I could tell you with certainty the performance of that stock. It would be enormously valuable information, such I'd probably be going to jail for insider trading. But what I'm here to talk about, the first half of the talk, is to tell you about an investment opportunity with far better rates of return. And I imagine, given the audience and the organization, it's not a surprise to hear me say that's going to be trees. Now, the cynical among you, and being an economist, I welcome cynicism, may be wondering why, if trees are such wonderful investments, you don't see stockbrokers, they aren't all down the nursery buying trees. Well, the reason is not that trees aren't great investments, is that there's a problem with the distribution of tree benefits. If you buy a stock, you buy one stock of Sprint, you're going to bear all the costs of that purchase. Similarly, if that stock goes up and you sell it for a profit, you're going to get all the profits. But trees are different. If you plant a tree in your yard, you're going to bear all the costs. You have to pay for the tree, you have to water it and so forth. But that tree may shade your neighbour's house and reduce summertime cooling costs, say, or it may help improve water quality for the whole city you live in. Even the sequestered carbon may improve the climate in the entire world, at least in a marginal sense. Now, these sort of what I call spillover benefits, the problem is that free markets don't do a very good job of allocating resources to goods with spillover benefits like this. So if we step back a second and think about markets, all a market is an allocation system. It just allocates resources, does no more than that. And if certain conditions are met, then markets, they spontaneously rise and they allocate resources to their highest value use, which makes them very appealing. However, one of the conditions for markets to function properly is that participants bear all the costs and benefits of their decisions. And if you're planting a tree, you don't. You typically bear all the costs, but you don't get all the benefits. So here you have these spillover benefits, and that's the reason you don't see stockbrokers planting trees. They don't care about these spillover benefits. Now in economics we call this a market failure, and I used to fret about this. Well, it is a failure after all. But what more recently I've come to see this as an opportunity. It's an opportunity for groups, and by a group this could be a government group, it could be the urban forestry department of a city. It could be a homeowners association, or it could be a non-profit. And they can take advantage of these investment opportunities because their scope allows them to. What I mean by that, imagine, let's go back to our simple example of the two neighbors with shade tree. Now, if let's just assume, for example, you plant the tree in your yard and it shades just your neighbor, that's the only one. Well, the two of you together could capture all the costs and benefits. One wouldn't, because you would capture all the costs but not the benefits. But if you got together as a group, then you could, perhaps your neighbor could help bear the costs, or they could give you some of their savings or something along those lines. So you could internalize those benefits and you could get rid of the market failure. Depending on of course, it depends on how far it spills over to see how big the group is. If you're talking about water quality, for example, it may be an entire city. Carbon, it might be the entire world. So shade is a small one. So there's two things I really want to take away from this talk, and this is before I get into the specifics of the study. I want you to have a sense of the magnitude of urban tree benefits and their distribution. So both magnitude and distribution are things I want you to think about. So enough of my introduction. Now I'm going to talk about two studies I did in Portland, Oregon, one on trees and house price and the other on trees and rent. And the first one, trees and house price here, this slide shows Portland here, and every pink dot, there's 3,479 single-family homes that sold between July 2006 and April 2007. So this was the tail end of the housing boom here. And I sent a student to each one of these houses, and I wasn't sure what attributes of a tree mattered. Maybe it's not just the number of trees that affect house price, maybe their size, who knows, it might be diameter, their species, the crown area. I wasn't sure, so I wasn't sure. I wanted to measure it all. But a lot of these things, for access reasons, you can't wander around in people's yards and measure their trees, so we limited ourselves to street trees. So my student went to every one of these houses and measured the street trees outside it, and then we used Google Earth to measure the crown area just from above. Now, anytime you're doing this sort of thing, you've got to be careful to control for house and neighborhood characteristics. And it's always a problem in tree studies because you get what I call the nice tree, nice neighborhood effect. The nicest trees are going to be in the nicest neighborhoods. That slide I showed you just now is in a pretty fancy neighborhood, fancy-ish neighborhood in Portland. And if you don't control for that stuff, you're just going to pick up the effect of the nice neighborhood. But having done all that, I will show you this next slide. So what we have, if my arrow, this house here, the dark grey house, which is the house that this tree here fronts, on average, a street tree added about $7,600 to the price of that house it fronts. However, a street tree also added $9,200 to these houses, not to each one, but in total to those houses within 100 feet. I think there was an average of 7 or 8, so this was sort of $1,500, $2,000 a piece. So it wasn't that it was more valuable, but you're sort of getting these spillover benefits. So this is a classic case. You're seeing the person here, and in Portland, the planting and the maintenance of street trees is responsibility of the adjacent homeowner, so this person here. So they bear all the costs of this tree, but they only get about 40% of the benefits. So what we know for sure is, from economics, that you're not going to get enough from a community point of view because you've got these benefits leaking away. Now, in Portland, the city estimate that the total annual, both public and private cost of maintaining street trees is about $4.6 million. And you can convert these amounts, $7,600 and $9,200, you can convert them into annual benefits. And it comes out about 45 million. So that's a benefit cost ratio of about 10 to 1. Or another way of looking at is a return on investment of 1,000%. So it dwarfs the 138% from Sprint. And also anything that increases the sales price of a house is necessarily going to increase property tax revenues. And so in this case, I estimated about $13 million a year. So the city's investment, although they don't maintain street trees, the entire urban forestry budget is made up for several times over just in terms of increased property revenues. So that's even ignoring the benefits that accrue to homeowners. So clearly a pretty savvy investment makes those thieves at Sprint look like they're not performing quite as well. And also there's the uncertainty. In the case of Sprint, you could buy a stock on the 1st of January 2013, but I suspect you're not going to get 138% return this year. Now, not everybody owns a home. In the US, about 2/3 of the population owns a home. So there can be some real environmental justice issues if you just use the preference of homeowners to inform environmental policy, because renters tend to be poorer and more likely to be a member of an ethnic minority. So the type of study I just showed you now, the sales price is called Hedonic Study, and these are pretty common in economics, largely because economists are lazy. And sales data are collected for tax reasons. So I can just call up my contact at Multnomah County here in Portland. They'll send me a big spreadsheet with all the property prices in. It's great. Rents aren't collected like that. So it makes these studies a little bit more difficult, or at least time consuming to do. So I did what most people do when they look for something. I went to Craigslist and I got a student, and we decided in advance that we'd have 1,000 single family homes, which is this other study was also single family homes. And we decided that would be a good sample size in advance. And we started collecting data October 2009, and every day she would go to Craigslist and collect information on all the houses that fit our criteria, and then we would go look up the attributes of the houses. And it took till January 2010 to collect enough data. Now, part of the motivation of this study was comparing sales price to rental. Is it necessary to own a tree to benefit from it? Now, as I said, in the sales price study, we were limited to street trees because of access issues. But what it turned out is the only thing that mattered in the sales price was the number of trees and their crown area. And both of those we can do remotely with aerial photographs. Sometimes it can be difficult when you've got a lot of trees in a yard to tell how many there are, but sometimes a Google Street View, or we would just visit the house, look over the fence, and we could typically work that out. So in this study, we looked at both street trees and lot trees. And what did we find? Well, a street tree added, on average, $21 a month to the rental price of a home. This is a single family home. And $5.62 to if it was a yard tree. So almost quadruple for a street tree. Why would that be? Well, I think the big thing here is curb appeal. A potential renter comes up to a house and the tree is right there. But there's also the issue. I'm a big fan of parking strips. I think they're fantastic because they're out in public, they're very visible. But also there's the issue of distance from house. Noel Nettersall, who is a professor at Reed here in town, has done some really interesting work showing that at some point you get diminishing returns. In fact, trees can have a negative effect on house price if they're really close to a house. I think that's particularly here in the northwest, where things could get a bit gloomy if you have trees right next to your home. And so I think the street trees are good in that sense as well, because parking strips are a little bit away from the home. Now, the math is not necessarily that straightforward to compare the sales price and the rental price, but I'll spare you all that and essentially say there's no statistically significant difference between the benefits that a renter experiences and a homeowner, which is kind of interesting. You don't need to own the tree to experience this stream of benefits. So that's my my two studies looking at trees as investments. So now let's look at trees as medicine. And what I talked about here is that trees may indeed be a good financial investment, but what I'm going to try and convince you for the last 10-15 minutes of my talk here is that they also may be a matter of life and death. Now, I think of them forests as maybe you should consider yourself as healthcare providers. You may think that's a somewhat bold statement, but I'm going to try and spend the rest of my talk backing that up. And so the first study I'm going to talk about is trees and life, specifically the relationship between trees and the beginning of life, birth outcomes in Portland. And I decided to look at birth outcomes for a couple of reasons. The first one is just data availability. Birth certificates have a lot of data on them. They have baby's weight, gestational age, they have all sorts of demographic information about both the mother and father, age, income, race, and so forth. Also, there are no diagnosis issues. Well, what do I mean by that? Well, I remember last year reading an article in the New York Times about autism, and it said that now 1 in 88 people in the US had some form of autism disorder. Now imagine if you were looking at the relationship between trees and autism over time, and you see this rise in autism. Well, is it because changing the number of trees, or is it because we diagnose autism more now? We're just more aware of it. Maybe we have a broader definition of what autism is. All those things would make it difficult, or impossible, but certainly difficult to study that. Whereas if you think of something like birth weight, if a baby weighs 5 pounds now, and you're comparing that to a birth that happened last year, and that birth weighed 5 pounds, you're pretty sure that those are the same thing. So any change in birth weight is a real thing. And then the last point here, and only a man who's never had any kids would probably say this, but is pregnancy only lasts 9 months. So what I mean by that is I had the address of a mother when they gave birth. Now, excuse me. Now, it's not guaranteed that the mother spent their entire pregnancy there, but I would argue that for 9 months, the majority of women spent all or most of their time there. And think of that in comparison to a disease that has causes that go back decades, something like heart disease, for example. So let's say you had the address of somebody when they went into the hospital because they had a heart attack. Well, how much would that tell you about their exposure to the natural environment over decades? I don't think it would tell you all that much. But something. But birth outcomes make for this nice 9-month chunk of time that's relatively easy to control for. And then the other thing that's important is this wasn't a data mining exercise. There has to be a reason to go look. And in this case, we've had past experimental stuff that has shown a link between shown that if you expose people to the natural environment, markers of stress like blood pressure, heart rate, and salivary cortisol, stress hormone, get reduced. And then other research has shown a link between stress and birth outcomes. So we have this possible mechanistic link between health and birth outcomes. It's really important that we have this link. We don't just run these models and then try and explain the results when they pop out the other end. So the specifics of this study. It was 5,696 singleton live births that occurred to mothers living in single-family homes in Portland in 2006 and 7. So singleton, I just didn't use twins and triplets for obvious reasons. We stuck with single-family homes, and this next slide will probably help show you why. Now this, on the left here we have color imagery. So this is just aerial photographs of Portland. And I should say these, the houses you see here, are just examples. For privacy reasons, they're not women who are actually in the study. So you have the color imagery. Actually, let's see if I can do that here on the left, this area. And then over here, what we have is the classified imagery. So you'll see these areas here, this green, that's tree canopy. And then this sort of light yellow is non-tree canopy. And then these squares or rectangles here, they're the lots of a house, and the red dot in the middle there is the centroid. Now, and then these sort of salmon-coloured circles are 50-meter buffers around each house. Now, the issue here is that we could identified the centroid of a house's lot, but when for an apartment complex, we didn't know where a unit was. We just had the centroid of the entire complex. And for a big complex, the amount of trees around the middle might not be that relevant to the person who lives over in the corner. So we just kept ourselves to single-family homes. And we looked at 2 birth outcomes. One, which is small for gestational age. This is essentially underweight babies, so below the 10th percentile based on gestational age and gender. So what I mean by that, if you had a baby that was born full term at 3 pounds, this is an underweight baby that's small for gestational age. If that baby was a month premature, then 3 pounds might be the appropriate gestational weight. But for our purposes, just think of it as underweight. And then we looked also at preterm births, so simply any babies born before 37 weeks. And again, we had to be careful of this nice neighborhood, nice tree effect. So we controlled for a lot of stuff. We controlled for demography of the parents, previous births. If a woman's had a history of adverse birth outcomes, that means they're more likely to have them in the future. The type of insurance. Does somebody have insurance? Is it public or private? Type of prenatal care they received. Then distance to stuff. Good stuff like parks. Open parks, public transportation, bad stuff like freeways. And we looked at characteristics of the house, the size of the house, even down to the heating and cooling system. We thought, perhaps air conditioning might reduce heat stress in the summer. We looked at crime around people's houses, and then finally we looked at tree cover. And so we looked at in these 50, 100 and 200 meter buffers. I've just got the 50 meter buffer on here, otherwise the diagram starts to look ridiculous. So what did we find? Well, we found that women with more canopy cover within 50 meters of their house were less likely to have an underweight baby, but there was no effect on preterm. Why could that be? Well, I think that here really the stress mediation is the issue. Also, trees can reduce heat and noise and improve air quality, and all of those things are stressors. Now, why would it affect underweight but not preterm? Well, this isn't hard and fast, but generally the baby's weight is determined by conditions throughout pregnancy. The type of things, stress, for example, that could be affected by trees. Preterm can also be affected by that, but it also can be affected by acute events. So if a woman gets an infection, if they have a car accident, then that could affect preterm. And clearly trees can't mediate something like that. And so it's really important that negative results can sometimes be as important as positive results. So we didn't just see an across-the-board thing here. Now, still, this may seem like a pretty weird study. How underweight babies in trees seems odd. This study was published in 2011. In 2012, so the next year, a paper came out in Spain, and this group had no contact with us, and they also looked at birth weight and gestational age, and they looked at greenness more generally, not just trees, and they found that mothers with more greenness within, I think it was 100 meters of their homes, had higher birth weight. So you have consistent results. So it's interesting when you have 2 studies, independent of each other, different countries, measure greenness differently, use the different statistical models, and you get consistent results. Doesn't prove causation, but I think it's maybe we're onto something. So enough about all this cheery babies and birth. Let's talk about death now. One of the reasons it's really hard to study the relationship between trees and health is that trees are not a very patient guy, and trees take a really long time to grow. Imagine if you were going to do an experiment. You say, okay, I've got 100 people. I'm going to stick them in 100 identical houses. I'm going to plant trees in front of 50 of the houses and then not in front of the other 50. And then I'm going to make the people stay there, have identical jobs, eat the same thing, do the same stuff, and I'm going to wait 50 years to see what happens when the trees grow. Well, you can imagine something like that would be expensive, time-consuming, and probably illegal. It's just not practical to do, often to do experiments in the same way we would with a new drug or something. But the study, it was a few years ago, I realized, yeah, trees may grow slowly, but they can die quickly. And so fundamentally, if you instead of thinking about what happens when trees grow, if you just think what happens when there's a change in the amount of trees, then that opened up some possibilities. And of course, in the last 10 years, one of the most effective things that's killed trees has been emerald ash borer. So essentially, you've got this big tree removal experiment. That's how I think of emerald ash borer. If trees do have a public health benefit, then killing 100 million of them in 10 years should have a measurable effect. So it's this what we think of as a natural experiment. It's tragic for all the people who've lost trees, but good for me. So I decided to look at what was the health outcome I looked at in this case was death, was human mortality. Well, why did I choose that? Well, somewhat like births, there's no diagnosis issues. We know when somebody's dead or not. There's good reporting. There are reporting requirements of deaths, so over 99% of them in the US are reported, and it matters. We're not looking at toenail fungus or something. We're looking at literally life and death stuff. If that doesn't matter to you, then nothing does. And I looked at 2 causes of death that could be plausibly affected by trees, because again, there has to be reason to go look. Cardiovascular, because of stress and air quality issues, and then lower respiratory, or with I think my English accent gets that wrong. Respiratory would be, I think, the US pronunciation. So what I did was, this next slide shows you, these are the 15 states that had at least 1 case of EAB in 2010. And these, the units here are the counties, and this is canopy cover, in this case from all species. So there's almost 1,300 counties in this study area. So I looked at county level mortality, and I looked at it from 1990 through 2007. So a real long running period before EAB arrived in 2002. And then I only get mortality data till 2007. So I had 6 years there of when the EAB was there. And again, we had to be careful to include a wide range of demographics. Things like race, income, education, the type of thing you would imagine. Well, what did we find? And also we looked at tree cover, and this is using national land cover data. What did we find? Well, we found that counties that had an emerald ash borer infestation had higher rates of cardiovascular and low respiratory mortality. And both the significance and the size of this relationship got bigger the longer you had infestation in a county, which makes sense because it takes a little while. Both it takes a little while for the trees to die, and also you'd expect any human health effect to lag behind the tree effect. Also, this was interesting, is I found also that there was a bigger effect or relationship, not causal, bigger relationship in wealthier counties that had above average median household income. Well, how could that be? Well, think of it think of it like this: if these wealthier counties are going to tend to have more and better maintained trees, and if those trees do provide a public health benefit, then killing them are going to have a bigger negative effect. So you have this what may initially seem counterintuitive, or a bigger effect in wealthier areas. There's also the possibility, though, that trees have different, not just that there are a different amount of trees in wealthier areas, but they have a different effect. So there was a fascinating study done, it was a few years ago now, I think late 2008-9, something like that, looking at the relationship between house price and being next to a park in Baltimore. And they found it in wealthy areas, as you might imagine, being next to a park was associated with higher house price. In a poorer neighborhood, it's associated with lower house price. And just in crude terms, in a wealthy neighborhood, you go to the park to play frisbee. In a poor neighborhood, you go to the park to buy drugs or get shot. I mean, these are magnets for crime, or can be in poorer neighborhoods. And so it may be that the trees are just providing different benefits as well. That's somewhat of a tangent. So the total effects we found was that an additional 15,000 cardiovascular deaths and 6,000 lower respiratory deaths, and that's over 6 years and the 15 states here. Now, I don't know how sick people were before they died. I'm not suggesting that. You had a 20-year-old who was perfectly healthy, a few leaves fell off a tree and they died. But 21,000, a non-trivial number. Now, another thing I did here is, remember I talked earlier about the importance of negative effects. We see a relationship where we think there could be one, but it's important that there is no relationship where there shouldn't be. What do I mean by that? Well, I also estimate a model looking at the relationship between EAB and accidental death. Now clearly there's no possible mechanism linking EAB with car accidents, for example, and I found no relationship. Now that isn't a control in the sense that you would have in a drug trial, but it's encouraging that we're not just picking up some broad-scale mortality effect. We're seeing it where it should be and not seeing it where it shouldn't be. But this study, even though it nominally is about emerald ash borer, it isn't about bugs and dead people. It's about the health benefits that trees provide when they're here, not really the consequences when they go. That's just a sort of pragmatic way of getting at the problem. And clearly, if there's an effect on human mortality, you would imagine an effect on other causes of well-being short of actual death. You would expect mortality to be the tip of the iceberg. And there's a number of policy implications here. Clearly, anything we can do to mitigate the spread of EAB, those, as you all know, somewhat limited now. It really suggests that we should be very aggressive, that if we were to be aggressive in stopping, I have to be careful not to say what we should do. If we were to be aggressive at fighting new invasives, you might get significant public health benefits from doing that. And also you're seeing a larger benefit in rich areas, which brings up some obvious public health and environmental justice concerns. So that is, I think, all I have for you. I want to leave a little time for questions, and I don't know if Robin is going to get on now and moderate those questions.
I am here. We do
Wonderful.
have one question. Have you extrapolated your investment study to include major urban areas of high population density, such as New York City, Washington, D.C., or Los Angeles?
The short answer is no. It's tricky because there's the specifics of the housing market. So I wouldn't expect these same numbers to apply in New York. Other people have done some studies. There's been studies, isolated ones, I think there was done in Philadelphia, there was one in Perth, Australia, and you're seeing qualitatively the same thing. Trees are relate to a significant increase in house price, but you can't really just extrapolate across the board and say, well, it's going to be $7,600 in New York or DC. It won't be. I would expect it to be the same order of magnitude, but I don't know the exact number.
All right, are there other questions? We have some people typing, it looks like. So.
I see that. What are your plans for future research? Well, thanks. I got some new stuff coming up. I'm looking at some in this study with emerald ash borer. What I looked at was county level mortality, and that's always it's not as good as if you can look at the individual level. So I just have access to data from it's called the Women's Health Initiative, which is a study that's 120,000 women followed from the mid-90s on. And I'm going to look at the relationship between emerald ash borer and the natural environment, other aspects of the natural environment and health. I'm actually also going to include lichens as a measure of air quality in that one. What else am I doing? I'm looking at how trees may affect gentrification and urban renewal. So when a city gentrifies, do parks, trees and things affect the course of gentrification or urban renewal, depending on your view of that?
Jeff, are you planning on continuing to look further down the line with the research that you're doing here? Are you going to be, is this an ongoing research project?
Yeah. I've the urban tree one was meant to be kind of a one and done thing. I was mainly done work in wildfire research, but the house price one was the first one, and it was just a kind of a pragmatic choice because I'd done some stuff with house price and fire, and I thought, well, I could. My boss at the time made an off-end comment about urban forestry, but just when I was walking around the neighborhoods with my student, I would go out with her about one afternoon a week. You would see when you go from blocks with a lot of trees to blocks with none, and in East Side Portland, you often get that real patchiness. there was such a profound effect. I thought there's got to be more to it than this. I've also done some stuff with trees and crime, some trees and water quality, so stuff like that. I'm definitely in urban tree research for a while, and particularly the public health stuff is fascinating to me. Seeing somebody else typing there. Okay, let's see. Is anyone sure how close trees need to? Ah, right. Yeah, good question. So, how close does it have to be for air quality? Well, that's an interesting one, and that's one of the reasons we're going to start looking at lichens, because lichens are interesting stuff in that they kind of have like having these little air quality monitors out there. So we plan on measuring, doing hundreds of plots in Portland over a very small scale, and seeing how air quality varies with tree canopy cover over, real micro levels, say one block to the next. So yeah, that's a good question. So that's what we're doing. And then here's another question: an economist, can you place a dollar value on the presumed health savings? Ah, right. Yeah, you can. There's a whole series of there's also a stream of research called the value of a statistical life in health economics, where you see, well, you look at people's behavior, often the type of money they'll take to do risky jobs, for example, and you can kind of infer a value, and often it's somewhere in the sort of $2 to $7 million. That's what value of a life. Not in the sense that people take $2 million to die, but they will take a portion of that for a risk. So yeah, if you want to look at mortality, you could multiply out the however many thousand by $2 to $7 million, and you can see pretty quickly you're going to get a pretty big number. Okay, let's see. There's another question here. Can you make urban tree research and crime available? Yes, I have a website. Thank you for saying that. Well, first I have two slides. I had a picture of a baby sloth because I thought the death stuff was depressing, so I put that up. But next is my website, and it's actually just in the process of being updated. So if you try it and it doesn't work, try tomorrow or something. But my crime stuff is on there. So yes, you can have that. And almost the urban tree stuff should have the journal article and then a 2-page summary. So that should help, because I wouldn't recommend reading these articles. I don't want to read them, and I wrote them. So let's see. What am I making efforts to share with policymakers? Well, I try and do these sort of things. We create these little fact sheets. I am trying to create some videos. Going down to, I speak once or twice a month now, so I'm always happy to speak. I mean, with the Forest Service, we really try and we're an applied research organisation. I always think of it, if somebody needs to make a better choice based on the type of information I provide. If they don't do it, then I'm not doing my job, and so I really do try and take that transfer part seriously. But if anybody has any suggestions on that, more than happy to take them. So here we have, what's the lag in lichens? Yes. About the lichens are interesting. They integrate. It depends on the pollutant, but they integrate over about a year. So they'll show air quality over a year. So we plan on sampling them both in about 235 places across the city, and then also resampling over time to see how things change. We're looking at particularly at something called polyaromatic hydrocarbons, PAHs, which are very nasty carcinogenic things which often come from, in Portland, for example, with wood burning, you get them. So we're trying to look at the sort of variation there. Hope that answers the question. But by the way, any of you have other questions or want to talk to me about this, either email me or call me. I'm more than happy to answer your questions. There's another one here. You may want to watch by... Yes, I will look at that. Any other questions?
Jeff, maybe I'll just type in your
Oh, my email
Or
address or my
yeah,
phone
your
number. Yeah,
email address really quickly here. It's
I can. Yeah,
fs.fed.us,
yeah,
correct?
yeah. G Donovan. Yeah, and then my phone number is. Do you want me to just type it in?
Sure.
Let's see if I can put it in here. Actually, uh, uh, there you go. There it is. Yeah, I'm more than happy to talk to you about this, particularly the tech transfer, the policymakers. I try and get the word out, but it's um, yeah, that can be problematic getting people to, particularly policymakers. They seem to have a pretty short attention span.
It's
Did
kind
I
of the
say that out
bits and
loud?
yeah, it's kind of a situation of if it's not in bits and bytes, they have a hard time listening to it. As that's what
Yeah,
I
like
found.
yeah, it can happen, and you need to simplify it. And I've used mass media. Sometimes that can be effective, but you should try and create a simple message. But sometimes things are kind of complicated, and you can't completely reduce them to sound bites as much as we would like to try.
Yes, it is always a struggle. Well, this is something. This topic is something that is kind of off of what we've been experiencing here, as far as what we've discussed with emerald ash borer. So it's always interesting to see a whole other side of what pests like this do to, our environment, to our landscape, and that kind of thing. This is going to be important information for sure on down the line, especially the more we encounter pests that are going to be killing our trees and landscapes. So I really
Yeah, I
appreciate you
mean, one of
coming
the
on and doing this.
yeah, no problem. I'll just leave maybe one thought is that I've said this before, but is that some of this research, the public health stuff, maybe trees are part of our public health infrastructure. Maybe that's one way we should start thinking of them. That we have this fundamental connection to nature, and that you get this relationship, and that we should just start thinking of it as essential as, say, clean water or clean air or something like that.
It makes sense to me. I mean, we're all part of one big earth. So.
There you go. But
right.
Thank you for inviting me. I appreciate it.
Well, I'm so glad you were able to join us. I know it's a little early out there in Portland, so but
It is.
we all let's see. Oh, we have one more question. Did you look at any differences in public health outcomes from areas of low ash percentage versus where they comprise 20, 40, and 60% of the stem count?
Yeah, it's a good question. That was a little tricky because I knew where the emerald ash borer was, but what I did is in the model I put in ash canopy cover, the best I could estimate it, and areas with more ash canopy had lower mortality, and so you had this what appeared to be a public health benefit from ash, and the longer emerald ash borer was in a county, that effect faded away. So again, sort of consistent with this idea that you have a sort of that the public health benefit is sort of proportional to the amount of trees, or the public health damage is proportional to the amount of dead trees. So yeah. Oh, there's the million tree one. Yeah.
Okay. Very good. Thank you.
Cheers. Well, if nobody has anything else, I'm gonna go to the dentist.
Well, thank you very much. I'm going to leave the meeting open just a couple more minutes so people that want to access the survey can do that. So thank you again, Jeff, and we appreciate all your time and hard work, and it's very interesting. I hope you'll come back and tell us what else you found here in your continued research. Thank you.
I'd love to. Thank you.